hover, drop. This is our water, I think. Yeah, for this guy. He had a cap on. All right. This is missing the sheath. You would have a pulley out with a sheath on the... Did you guys have the sheath out here?
No, it wasn't on there to begin with.
Is it? Do you have a sheath I can borrow just real quick from your pulley? Okay. This is where you guys probably make this so much more difficult than it is. I don't want to see anything like this. Okay? I don't want to see anything where you're lifting it up out of the tray because it can drop down and get contaminated. I don't want to see you create a problem that you have to now get yourself back out of. Why did you do that to yourself? All right, easiest way, you're going to open. This needs to be opened at the top on a brand new kit. It's sterile. It's not. It's happy in there. Okay? It's sterile to sterile. So we're just not going to risk it. We're going to pinch this, and we're just going to let it slide into its little sterile box. I haven't made a mess out of this. I've kept it in front of me. I don't want to accidentally have this come back and hit something and transfer that bacteria. You see it? Over to this hand. See that happen? And you're unaware when you're doing all of this, and your sleeves are here, and it's hitting, and you take that bacteria and transfer. These are the awarenesses you've got to have now. So we're cleaning this up, making it real obvious. Hover, drop. Okay, get that puff back where it was. All right. So now we're just going to take our syringe. When you pick it up now, all right, you can take your cap off. I like to drop it back in the tray. I don't like that in there because where do they end up? In their bottom. Yeah. Okay. And you can start little decubes with these, all right? So we're going to hook it up. Some of you might have been taught to test it. If you're testing it, what you're testing is the balloon integrity. Do I have a defective Foley? So you've got to push all of it in to see, does it tolerate it? Yeah, it's great. Everything's good. Right? So now we'll let it come back out. If you were not taught that, don't worry about it. Some of you were, some of you were not. Okay. So we'll let it come back out. While we have it here, we're going to go ahead and get it lubed up now, so that it works well when you come on over in front of your patient. I want you to look at the box. The Foley, think of this as the arrow. This is what you want pointing towards your patient. Doesn't matter what the rest of this catheter is doing. This I want going the direction of the patient. I'll show you why when we get over here. So I'm going to think that way. I want that this is the front then. I want that going toward my patient. Put this on top. I like to see you grab it with two hands. I think you have more control, especially if it's the first time you're doing a Foley. If you're doing like this, and I like to see you have some nice firm control over it, and then come on what I call it's just called driving it on in. Okay. So now once this hand goes down, it's going to be contaminated. There's no turning back. So would you mind moving your hand back down? Okay, that's great. Thank you. All right. So get yourself, you haven't prepped yet. On the other mannequins, the perineum is firmer and a little bit harder. Get your hands where you need them to be, however that is, before you prep. Now you can do the moving around, but once you prep, you can't. Just get your hands stable, however you want for comfort. Now you're going to start your prepping. Inside of the labia, top to bottom, come around your box. You don't want this contaminated bacteria going over something sterile. So down, away from me, and I'm going to come around. You can come through this way. If you're not comfortable with that, that's a little too risky because, ooh, I don't. It's a heavy patient, they're not very limber, they weren't able to give me much room here, it's too risky going over, then I'm not going to risk it, I'm going to go like this. Okay? So it kind of depends on the situation, then right down the middle. Nah. So either way, you have to watch what you're risking hitting. Hold the box, hover, drop. Now I'm going to get my Foley, and this is the reason why I directed it this way, is that if it was going this way, this is what it has a tendency to do. You see? And while I'm all focused right here, I'm not focused on what's happening right here. And I've contaminated the Foley unaware. All right? So get it to cooperate with you. I'm holding my space. All right. All right. And you can give them little distracting things. Take a deep breath in and relax. Blow it out. All right. Now you're seeing the urine come out. All right. So you know you're in the bladder, but we've got to clear that balloon from the neck. Right? So we're going to advance it how much more? 1 inch. At least. All right. So if it's a little hard to figure out, just see where you are right now. So maybe you've gone in this far. See where you are. Back up 1 inch, and now go in that far. Now you know. Okay? Now I've got to stabilize it so it won't slide. This is probably one of the most common mistakes you guys forget to stabilize it. Otherwise, it's going to slide right back out. Moist mucous membrane full of KY jelly. Okay, there's nothing to hold it in there. So I've stabilized it. I'm going to inflate my balloon now. Okay, all of it. Now, tug. And especially if I didn't test the balloon, if I had a defective one, if I tugged and that balloon had burst, it would slide right back out. Okay? Now it's rare you get a defective one, but it has happened to me once, only once in my whole career, but it did happen. So I was glad to find it out when I was over here instead of here after I've already gone through all this, because that would have burst and I'd be here and I'd be starting all over again. So, little tug, we're good. This hand now comes down, disconnects while I maintain the pressure on it. Okay, that's trash. This hand's been on the perineum. I don't like to see you guys then tape, touch this. I don't like that. We wonder why we've got ick all over. Okay, grab. You should be in the habit of taking your gloves off. All gloves the same. Okay. If you want to put a pair of utility gloves on now, but everything here is sterile. Okay. You're going to lower the leg. Foley goes over, not under. You're going to verbalize that you're going to attach this to a non-movable part of the bed. All right. You're going to have the tubing coiled at the level of the bladder, not so that it's down with dependent loops that can interfere with proper drainage. You're going to tape it to the leg with some nice slack, all right? You don't want it to be tight. If it's tight, and physical therapy comes in and starts doing range of motion, right? What are we doing? We're tugging that, all right? Or when they need to move around. We need some slack so this patient can move their legs. Or when they're ambulating, they try to get up out of bed, whatever. So what I like to see you do, there's all different kinds of things that gizmos in the hospital to make this easier, but if there isn't, tape the tape to itself. Okay? These two are meeting behind here. And then tape it to the thigh. So this is suspended. I've seen these taped down very firmly onto the patient's skin. And if you look at the difference here, you see this can cause a decube, and I've seen this start decubes on patients. Okay? So this is a pressure. And what are decubes? Pressure ulcers. So not good if this is going to be on here for a long time. So this prevents that from happening. Okay, that's one of the best ways to attach it. And then the Foley doesn't slide. They also will slide as the adhesive breaks down and gets gummy. This can slide through, and it's like not even having it on there. Okay? All right, so I'm going to document now that a indwelling Foley catheter was inserted, 16 French, 10 cc balloon. How do I know that? I'm going to find that on the Foley itself. All right, so if you ever wonder, well, let's see, what size, I'm going to go DC a Foley now. Well, what size is that balloon? Well, okay. It's right on the Foley. 5 ml 10, 5 ml 10, okay? So I know what size, if it was a 30 cc, I would know I got to go get myself a bigger syringe. Or have to keep pulling it out. So if I want to DC, okay, so documenting the size and how patient tolerated well, or with difficulty, if there was some difficulty with insertion, and what came out. 300 cc's clear yellow urine, cloudy sediment, foul, amber, bloody, what came out, all right? Now, let's say a whole bunch is starting to come out. 300, we're at 400, 500. You know what? I'm going to stop this. I'm going to clamp it. Because this was the patient down in ER that they palpated and was coming back in after the TURP for distension because he hasn't been able to void. You know what, he's probably got a liter, he's probably got 1,000 cc's in there. And if I let all that drain out right now, what's going to happen? It's going to spasm. And this patient's going to have a lot of pain. So I'm going to let out a little bit at a time. So I let out that 400. About 10 more minutes, I'm going to come back. Let out a little bit more. How you doing? Okay, good. And oh boy, we're at 600. I'm gonna do this. I'll be back in another 10 minutes. All right. I'm gonna let it out kind of easy, and then we'll open it up and let it all out. So we can use that to clamp it. All right. Then when we need to DC.